Me again. Why mental health workers' Bill of Rights? First, I want to read you our Bill of Rights. Mental health workers' Bill of Rights. Mental health care workers provide care for people with special needs. To provide quality care, there must be some basic rights and standards that every mental health care worker has a right to expect. Core elements of the Mental Health Workers' Bill of Rights are: number one, the right to a safe workplace, including protecting oneself from harm with consideration for the safety of the patients, and the right to refuse work that poses a danger to one's health and safety. Number two, the right to adequate staffing levels. Number three, the right to adequate and up-to-date equipment and techniques to ensure safe working conditions and quality care for the patients. Number four, the right to family supporting wages so that mental health care workers can devote their time to the care of their patients and not have to take on second jobs. Number five, the right to refuse excessive overtime. Number six, the right to timely briefing about the behaviors of patients that workers are assigned to care for. Number seven, the right to be treated with respect and dignity, regardless of job classification. Number eight, the right to fair and equal treatment and opportunities regardless of race, gender, age, national origin, immigration, sexual orientation, physical abilities, or religion. Number nine, the right to a grievance procedure, which includes the right to grieve all matters that can impact safety, evaluations, raises, transfers, and promotions with representation of one's choice at all levels. Number 10, the right to have input in decisions impacting working conditions in the facilities where one works and at the division and legislative levels. Number 11, the right of workers to evaluate the performance of their supervisors as one of the criteria for their raises and ongoing duties. Number 12, the right to belong to a union and engage in collective bargaining over terms and conditions of work. These are the core elements that we're asking the legislature to pass the bill on. The testimonies that you will hear this evening will bear witness to the problems and the issues facing mental health workers throughout the state on the negative impacts of what I call a failed and flawed state reform system. The state reform system started in 2001. Here we are, 10 years later, and the conditions facing mental health workers, in addition to the fair reform plan, are intensifying as part of an increasing attack on all public services with millions of working class and poor people depend on. The lack of adequate staffing, increasing amounts of injuries, unfair forced overtime, lack of family support and wages, discrimination, policies and budget decisions on the delivery of quality care for the people with mental and retardation conditions, and the families that have a right to expect will be heard here this evening. They speak to the core elements of our Mental Health Workers' Bill of Rights. We need a Mental Health Workers' Bill of Rights that strengthens our ability as workers to provide quality care and to protect ourselves from the abuses stemming from the lack of enforceable worker rights and the attacks that are occurring on the public sector. A legislative Mental Health Workers' Bill of Rights is especially needed to establish fast standards for workers to provide quality care in the state that denies public sector workers the right to collective bargaining. To help establish enforceable standards, North Carolina General Statute 9595, banning public service workers the right to collective bargaining, is a Jim Crow statute that must be removed from North Carolina books and buried. If we don't, we're not going to flourish, and we're not going to move progressively into the 21st century. And it's the only way that this state can truly be the good old North State. Otherwise, it's not a good old North State. It's giving us hell. Okay, now we're going to have a presentation by Ms. Alexander. Are you ready? Okay. And this year we'll be talking about the budget projections and the possible impacts on the working people.